Hello again, everyone, and welcome to today's episode of Resilient Health Radio. I'm your host, Dr. Darin Ingels, and joining me on the podcast today is my friend and colleague, Dr. Jennifer Bahr, who is a fellow naturopathic doctor just a little south of me in sunny San Diego, and she has specific expertise in homeopathy and PANDAS. So we'll talk a little bit about both today. So, Dr. Jen, thanks for joining me on the show today.
I'm so happy to be here. I love the name of your radio show too, because my practice is called Resilience Naturopathic. So I love
I
that I'm
know.
on like the Resilient Health radio show.
Well, we certainly talk a lot about in naturopathic medicine about helping people become more resilient, which is why, I wanted to name the show this way. And I think,
Mhm.
anyone who's really practicing functional medicine, we are driven by that core of, helping people heal in the way that nature intended. We're trying
Yeah.
not to use things that interfere with this innate ability to heal. I say this over and over and over, and I'll say it again, it is built into our DNA to heal. The body knows how to do all these things. We just
Hmm.
got to get all these obstacles out of the way to allow
Right.
that process to happen. And
Right.
I think that kind of takes us into our first topic here about homeopathy. And
Hmm.
it's something that every naturopathic doctor learns about. However, I think it's a fairly small percentage that go on and really integrate this tool of healing into their practices. So for people who may not be familiar with homeopathy, can you just give us a little background and history on what it is?
Yeah. Like how far do you want me to go back? So
Oh, we can go
I
back
think
to Hahnemann.
we can go all the way back to Hahnemann. Perfect. So let's go back a couple hundred years. So the homeopathy has been something that's been around for it's over almost 250 years now from when it was first understood. And it's actually, honestly, it's something that's been in existence for far longer than that. This was just when it was like really understood, studied, and systematized, and like brought out and like practiced and tested in people. So um, back a long time ago, Samuel Hahnemann was a doctor who was practicing in Germany when we were doing things like doing bloodlettings and purgatives and like using arsenic and mercury and everything for treating people. And he realized that he was doing more harm than good. And being the person he was like, I'm not going to do this. And he like took down his shingle, and closed the door, said, "You'd be better off without me." And so he went to work just using his medical knowledge, and he was a chemist as well. That and his ability to speak, I think, six different languages, and he just fed his family by translating medical texts. And he noticed something, and when he was doing these translations, he noticed that this medicine, it's cinchona bark, was really good for treating malaria. But the person who had written about it said that it was because of its bitter properties that made it so effective for treating malaria. Well, being a chemist, he knew that there were far more bitter herbs and bitter substances than cinchona bark. And so he became curious, like, what is it? It's not the bitter properties. What is it? And for some reason, he decided to take it, to just take like some cinchona bark tincture and see what happened. And he got symptoms of malaria. And that's when he was like, wait a minute, what's going on? Because he had previously translated a text from Hippocrates that said something about this principle of let like cures like. And so symptoms, things that could cause symptoms that are similar to what you're experiencing could be used to cure those symptoms in somebody who's experiencing them as part of their dis-ease. And so he was like, wait a minute. So I was a healthy person and I took this and I got like symptoms like malaria, and this is known to be really effective to treat malaria. And so he put those two and two together, and he started testing lots of other things to see what they would cause in a healthy person, and eventually went back to practice and started applying this like cures like principle, and found that it was consistently effective. When he gave something to somebody in their unhealthy state that was known to cause similar symptoms in their healthy state, it was leading to cures of the disease. So that's where homeopathy all started. And it's been in existence, and people who are classical Hahnemannian homeopaths, such as myself, are following things that have been in existence and practiced effectively for over 200 years. Some people have questions about how this could possibly work, because part of this thing is he ended up really diluting the substances he was using, because again, he was working back in the day when they were using mercury and arsenic,
Right.
things like really toxic plants like belladonna that we know like a small amount could be lethal to people. And he didn't want to hurt anybody he was testing things on as he was figuring out this whole theory that he had. and started diluting the medicines. And he found that they worked just as well, if not better, than if he didn't dilute them. And so that's the part that people usually get super stuck on, is that like you're taking a very, very, very small dose of something that is meant to trigger similar symptoms. So the small dose is it can be a sticking point for some people, though. It won't be at all, because we're even talking like in conventional medicine, we're talking about nanomedicine, and homeopathy is like the original nanomedicine, because we now know there's nanoparticles that are formed in the process of like the dilution and everything. Um, so that homeopathy is not about the smallness of the medicine, it's about how it is applied. The
Right.
smallness is just about making sure that you're giving the minimum dose to have the effective response that you want. And the reason for this is there's the primary action of a substance and the secondary action of a substance. And the primary action is that what it's doing in the body. The secondary action is what the body is doing in response to the substance being present. And so if we give a very, very, very small amount of the substance and we get just like a little tiny bit of the primary action, barely noticeable, but enough to provoke the body to push back against it, it's like the equal but opposite sort of thing. So we give it a little bit of something that would cause a symptom that is similar to what they're experiencing, and the body pushes back against it with the opposite symptoms or opposite presentation, and that's part of how we're nudging the body to heal. So we're giving it the minimum amount to provoke that secondary healing response. Does that make sense?
Yeah. Yeah. I
Okay.
think it's like you mentioned, it's kind of a mental horror for people when you look at the dilution of a lot of these remedies, because if you remember from high school chemistry, there's this thing called Avogadro's
Mhm.
number, that if you keep diluting a
Yep.
substance out, you eventually get to a point where there's no molecule of that substance left. So if you took something
Yep.
toxic like arsenic and kept diluting it out, at some point, if you took it to a chemistry lab, they would say there's no detectable arsenic in this solution. And for those geeks out there, it's 6 times 10 to the negative 23rd. That's Avogadro's number. And in homeopathy, that starts at, I think, 12C or 24X.
Yeah.
That's when you hit that kind of number, where anything beyond that, there's technically none of the residual starting substance left.
Right.
And again, well, people say, well, then you're just giving placebo, right? You're just giving magic sugar pills.
Mhm. We have there like the good news is that like somewhere, I think it was in 2010, there were multiple researchers who um, through the advancement of technology were able to find nanoparticles up to 200C. We're still working on what happens beyond 200C. So now we can find some of the like some small evidence of the original substance at a higher the higher dilutions. We're still working on, I think eventually we'll have the technology to understand exactly what is happening, and especially at those higher potencies. But yeah,
Well,
yeah.
I think the one thing that I love about homeopathy, and again, I use it in my practice, is that it's really symptom based. In Hahnemann's
Yep.
time, we didn't have technology, we didn't have CT scanners and MRIs and blood tests. So, people were really treated based on the collection of symptoms. So,
Hmm.
kind of regardless of what the symptom picture looks like, you're going to treat that individual person based on that. So you could have 10 people that all suffer from migraine headaches and have
Yeah,
10 very different presentations of what that migraine looks like. Therefore, it could be 10 completely different remedies that are prescribed based on that symptom
exactly.
collection.
And the homeopathy, so it also takes the totality of the person into consideration. So we're not just going to look at somebody's migraines. If that's all they have, that's all for them to have migraines. I'm a migraine sufferer myself, but they're probably also going to have something else, right? Especially for any chronic disease, there's normally like one thing and there's something else that maybe you don't think is related, but the body is all connected. And so with homeopathy, we're going to look at your unique experience of it and the totality of you as a whole person and anything else that you're struggling with. And that is what's going to help give you the best results, where you're actually going to be nudged in the direction of healing, so that your body can recover and regain its own balance so that it can live its best life. And I love that you bring up like the symptom-based thing, because yes, homeopathy was developed at a time where we didn't have all these tests. And I love the tests that are accessible to us now. And how many of our patients do we see that like feel awful, but their tests say they're fine. And they end up
Right.
finding us because they're like, I feel terrible, but every doctor is telling me to go away or go see a psychiatrist because if I'm saying I feel terrible, but my labs don't justify it, then clearly it's in my head, but my body is feeling awful. And this is a place where homeopathy is so, so helpful because it's really focusing on what you're experiencing, not necessarily what a specific trigger is. So it's not like in Pans and Pandas, there's not going to be like, here's the remedy that people need if it's Bartonella. Here's the remedy they need if
Yeah.
it's Lyme. Here's the remedy they need if it's mold. Here's a remedy for strep. Here's a remedy for mycoplasma. That's not how it works because the same trigger and multiple triggers are going to have different presentations in people based on their unique susceptibility. And homeopathy is really at the core addressing that underlying susceptibility to having this atypical presentation, pans and pandas in particular, to like an immune trigger, right? But for anything that is used in any chronic illness, homeopathy is going to consider what's happening to you and like what you're experiencing to help with your susceptibility to those symptoms and not necessarily saying like I have to go after this particular thing. I have to like kill this infection. I have to change this detox approach or do these detoxes. Because I mean, some people they just honestly can't handle some of the big detoxes. Some people absolutely need them, and some people can't handle them. They need their body to like gently be nudged to do its own detoxing using its our own detox mechanisms. And homeopathy can absolutely help with that for people who just can't tolerate some of the more aggressive approaches.
Yeah, for people who might have some limited understanding of homeopathy, or maybe they've tried some remedies, they went to the health food store, they bought some over-the-counter stuff. Can you talk a little bit about the differences? Because, like I said, you and I are kind of trained as classical Hahnemannian, which means
Yeah.
we give one remedy one time. There are companies out there like Highlands that make combination remedies.
Yeah.
Can you talk a little bit about, when might combination remedies be good? Are you better
Mhm.
off using one remedy one time? What are your thoughts on that?
So combination remedies, I think, are most helpful in like acute conditions because what they're doing with that, it's like a shotgun approach where they're trying to say, well, here's the most common remedies that are going to be used for cough, or here's for runny nose, or here's for allergies. And so there's a decent chance that the remedy you need will be in that combination. And so they're kind of hoping that you're going to respond to one and just ignore the others. So in acute illness where you're going to recover anyway, right? It can help speed it up for some people. When you're dealing with complex chronic conditions, even if you don't feel like it's complex, still anything chronic, you're really going to want to find something that is the single remedy that is best matched for you and honestly managed by somebody who knows how to help see you through to full recovery because it's unlikely in chronic conditions that you'll need a single remedy one time and you're cured.
Right.
It's generally, even, Hahnemann talks about this in the Organ of Medicine and in his book about chronic disease, where he was really trying to understand how these chronic conditions came to be and how to effectively treat them, that you often need multiple different remedies, but not at the exact same time. It's almost like we have to peel back layers of an onion to really get to the core to help you fully recover. So a single remedy that is matched to you and your specific susceptibility, your specific presentation, and then managed through to completion is going to be more effective in anything chronic. Does that make
Yeah.
sense?
Yeah, I mean, I think about like there's a remedy called Rust toxicodendron, which
Yeah.
is homeopathic poison ivy. Yet we really don't give it for poison ivy. It's for other types of rashes and things that might look like poison ivy. So again, I think it's a concept that's important for people to understand is that, because I know like if you go to the health food store and you get like a Boiron, remedy
Hmm.
on the label, they're required by the FDA to put
Yeah,
condition. And I find half the time the condition they list is not the primary thing you would even use that remedy for. So it can be a
exactly.
little misleading if you don't really have an understanding of the remedies and what they're used for, and you're just kind of going off what you read on the label. It could be sometimes, again, a little misguided on getting the right remedy.
100%. I'm looking at Nux vomica that I have here on my desk right now, and
Yeah.
it says that it's useful for heartburn or drowsiness due to excessive eating or drinking. And I can tell you that this is a really good remedy for constipation. It's a really good remedy for headaches. It's a really good remedy for anger and depression. There's like so many things. And that's one of the things too, is that there's, you mentioned rest toxicodendron, like I think, yes, rashes, but it can also be used for colds and flus and arthritis and, all sorts of things. And so that's really where when you're dealing with something that is, um, chronic or ongoing, it's really helpful to one, use a single remedy so that your body isn't, trying to figure out what to do with the chronic condition and multiple remedies at the same time. Because again, we're giving a little bit of that medicine that's going to have a bit of a primary action, and the body has to give the secondary action to know how to respond to heal. And if it's got seven different things, it's saying, what am I supposed to do? A challenge with it too is that there's, like I said, hundreds of years of evidence and literature and documentation for how to apply these medicines. Because again, it's not the dilution, it's how we apply it that makes it homeopathic. And so we've got hundreds of years of evidence, and that's all on single medicines, right? So we don't have any actual evidence on what happens with the combination of
Right.
these things and how does the body respond to this combination. So people will use them because they're so low dose that they're non-toxic, they're very safe, so they're not likely to have anything bad happen if they take them. But if you really are struggling and need help, it's better to actually be more precise than that, having that shotgun approach.
So I know in your practice, and you and all the other doctors there, you guys deal a lot with kids dealing with PANS. And for those who
Mhm.
are unfamiliar, it's pediatric acute-onset neuropsychiatric syndrome, which is often triggered by infection, but it can be potentially other things, and basically causes this neural inflammation that overnight these kids, from being normal, healthy, happy kids to having OCD and anxiety and tics and sleep disturbance and behavior issues, and they're falling apart in school. And it gets to be a very kind of complicated mess for a lot of these families.
Yeah.
How is your approach with homeopathy, maybe a little bit different than what a lot of other doctors are doing, which are often things like intravenous immunoglobulin and steroids and ibuprofen, which is really just all about how do we just shut, that inflammation down?
Right. So the standard approach in the conventional medical approach is like, threefold. We're going to try to attack the infection, we're going to attack the inflammation, then we're going to do symptomatic treatment. And then if those three things work, so that's going with antibiotics, that's going with anti-inflammatories, and that's going with psychiatric medications. If any of those three things don't work, and they usually work for a minute and then they stop because they're all addressing the symptom, not the problem, right? You think you're going after the problem, but it's not strep. It's the susceptibility to having this atypical response to strep, right? If strep was the problem, everybody who got strep would have the same
Right.
symptoms, would have the sore throat and the fever. So it's the susceptibility to this atypical response. Strep is not the problem. So if we just kill the strep, it's going to help for a minute until you have strep again. And then the antibiotics are not going to work as well. And then we add another antibiotic. And the thing is, it's an atypical immune response, and you have one trigger, it typically expands to multiple triggers, right? So then strep is an issue, then mycoplasma an issue, then you're sensitive to mold, then you're sensitive to chemicals, then allergies make you flare and you're having, symptoms. So anything that like makes the immune system go up makes the PANS flares worse. And so then we're looking at like broader, things. Some people will get their tonsils taken out to try and avoid the infection. IVIG will be so intravenous immunoglobulin. Say that three times fast. Is often recommended in hopes that you're basically going to borrow somebody else's immune system and hope and like that it's going to function better. So you're basically taking pooled blood products from the community and getting these immunoglobulins to help fight the infections and try and restore an appropriate immune response. And we're finding more and more that these are just like you need multiple, like every month to get these infusions, and that more and more people are needing even longer. It used to be, it seemed like at the first, when I first started treating PANS like a decade ago, that people would need one or two and they were generally doing a lot better. And now we're just seeing that it's expanding more and people are needing eight, nine, 10, and sometimes really still struggling. And that each one can have a diminishing return, much like the antibiotics. And these are all still going where we're trying to target the infection And yes, trying to improve the immune system, but you can't just borrow something from somebody else and like think that it's gonna make your immune system function appropriately in the long term. And so I mean, I know some people it works, and I'm surprised that it does. I don't know how it like gets them to recovery, and I'm suspicious sometimes of like, is what else might be going on that we're missing, or what other autoimmune condition is coming after this? Because we see an awful lot of secondary autoimmune conditions showing up in kids who are not addressing the susceptibility. So if you like functional medicine practices are doing similar things with like different approaches, herbs and nutrients, and also trying to make sure that like the systems are functioning more effectively and making sure that we're addressing like how they're doing their detoxing, supporting the immune system to work more effectively. Homeopathy goes one layer deeper. I think that like the functional stuff is great and helps an awful lot of kids that are failed by the conventional system. Homeopathy goes that next level deeper when we get to the like a 5-year-old saying, but why, but why, but why? And it really goes after that underlying susceptibility to having the specific presentation that you have. Like I keep saying again and again and again. But it's addressing the immune response. It's addressing the inflammation. It's helping the body fight infections more effectively and more appropriate, like we're supposed to. Like there's plenty of people who get exposed to strep and don't like their body fights it off. They don't get strep in at all. Whether it's like the typical symptoms or the atypical presentation like PANDAS. So it's helping the body so that it can fight its own fight. And when it does reach the threshold that it's going to have symptoms because it wasn't able to fight it off, that it has a more typical presentation rather than attacking itself and having the neuroinflammatory presentation that you talked about before.
So, what would be an expectation for parents who have kids dealing with PANS? If they start down the path of using homeopathy to treat their children, what's kind of a pathway, if you can kind of lay it out? Because,
Mhm.
kids often go through periods of flares and then they're better. The up and down cycle is very typical. So, what's your guidance for parents on, managing it with homeopathy?
Yeah.
I mean, what's kind of the expectation?
So for anybody with any chronic condition, you're going to see 2 to 3 steps forward and 1 step back, and another 2 to 3 steps forward and 1 step back because you're gently and slowly nudging the body to heal itself. Like we talked about, the body can heal itself, and it's just those nudges to get it closer and closer to its optimal functioning. With PANS and PANDAS, as you mentioned, there's like the flare, and then back to baseline, and then another flare. And it tends to be that like it's an increasing sawtooth pattern, right? So we have a flare and then we go back to baseline, but baseline's not quite as good as it was before. And then we have another flare that's a bit worse than the last one. And then we go back to baseline, quote unquote baseline, but it's also not as good. So we just have this increasing thing where our baseline is always a bit worse and our flares are a bit worse. We kind of see the same pattern with homeopathy, but it's going downhill instead. So we're going to still see flares. We're still going to see things trigger infections or exposures to various things that trigger an immune response. We're going to see flares still happen. We're just going to see them improve over time so that the flares generally get progressively better and baseline gets progressively better. It's not a fast thing. So it's not something like, don't go into see a homeopath and for PANS or PANDAS or any chronic condition and expect that something you've been dealing with for years is going to be gone overnight. That's not realistic. It's a years long process for most people. 2+ years. For me, I had PANS as a kid, and it transformed into all sorts of things as an adult. It took me over 5 years to recover with homeopathy, but I did. So it's not an overnight thing. It's not like a, smooth road. It can be a bit murky. Um it can be challenging sometimes because you can see symptoms that you thought were gone a long time come back, but it's really just the condition progressed and the condition itself suppressed symptoms. And so when we see symptoms come back, we celebrate because we're like, thank goodness we are at this deeper layer of healing. We're making progress. And usually, it's an easier time through it than it was the first time around. But it is a 2 to 3 steps forward, 1 step back, sometimes 4 to 5 steps forward, and sometimes 6 steps back. If you have like a loose teeth, loose teeth and PANS, they're a big thing. but we can recover so that people can have, like I said, typical response to all those things.
How would somebody know if they have the wrong remedy?
So the wrong remedy is generally just nothing changes, right? So with the right remedy, you're generally going to see improvements within a few days to a few weeks. So like if I'm seeing a patient and we've gone 3 weeks on a remedy with, consistent dosing, I'm not, and I don't see any changes, we're not on the right remedy. Occasionally we can see, because of that primary action, occasionally we can see a little bit worsening of symptoms. It's usually pretty clear, usually pretty short-lived, and that's actually a really good sign because it means your body's sensitive to the remedy and that you're close enough that like you have more of the symptoms you already have. And then when the secondary healing response kicks in, it gets much better. So if I see nothing at all, that's when I'm like, okay, we're on the wrong remedy. If I see any movement a little bit worse or a little bit better, we're on the right remedy.
And how long should someone give after they give their child a remedy to say it's working, it's not working?
Like I said, a couple of days to a couple of weeks. After a few days, that's not enough time to know for sure. Always looking for trends over time because this, like I said, it's not going to be like you take this pill and it's just boom, everything's miraculously gone. Homeopathy seems to get this reputation, I think, because of the minimum dose that like we just associate magical thinking with homeopathy sometimes. And while it can do miraculous things, it can do things that are shocking when you get the right fit for somebody. I can share some of my experiences with some of like the shocking things that I have seen in patients or seen personally too. And I think you've actually had some pretty miraculous experiences yourself as well. Um, that said, we shouldn't expect that all the time. We shouldn't expect that as the norm. Just like I always tell my patients, like if you take something for weight loss, right, and it gives you like a sudden, immediate reduction in your weight, that almost never actually sticks. It's not
Right.
realistic. You're not going to have that again. If you have that, it was probably at most water weight or some sort of inflammation that's settling down. It's not actual weight that's being lost or fat that's being lost, right? And so any like really fast, really amazing response, we love it, but that's not necessarily what's going to be sustainable for the body, and it's not necessarily what's going to get you through to the finish line because if we just are seeking and chasing like a big response for every dose that we take, um, the body just can't handle that. If we're nudging the body toward healing, it takes work.
Yeah.
So we want to see improvements in frequency, intensity, and duration of symptoms. So if you have rages as part of your PANS case, or you have really intense anxiety, really bad OCD, really bad tics, I don't expect any of them to be gone overnight. I expect it to go from 3 hours of rages to 2 hours of rages, and from 5 days a week of rages to like 2 days a week of rages. And I expect them to go from like we have to lock everybody in the room for safety to we're able to like stay in the same room and everything is okay and like it calmed down pretty quickly. So like not gone, eventually gone,
Yeah.
but up front, we just want to see things heading in the right direction at a pace that the body could reasonably sustain.
Yeah, I remember when I was a student at Bastyr and my homeopathy teacher saying, finding the right remedy sometimes is like finding a needle in a stack of needles. There are literally thousands of remedies, and some of them
Yeah,
are very similar to one another. So, yeah, we don't always hit the nail on the head the first time, and sometimes we have to work through several remedies to, try and find the right one that fits each person. So
exactly.
it does require a little bit of patience.
Well, and it's not even that there's like one right fit. It's like the fit for the person in this particular state that they're in this environment at this time. It's not like if you find the one remedy, you give it to them as the one remedy they've ever need, they'll be good forever. Your body responds to the environment that you're in, and it shifts and it moves and things change over time. So we typically do need more than one remedy to see things through in any chronic condition. So yeah, finding a needle in the stack of needles is for sure right. And finding the right fit at the right time and the right way, like the right dosing strategy for a person can take some time and some patience.
I know some homeopaths are really purists, and when you're doing homeopathy, they really don't want you doing anything else to really
Yeah.
assess what the action of the remedy is. How do you feel about it, when people are doing other things? Because again, it's not uncommon that kids are
Yeah.
taking vitamins and supplements and herbs and doing other devices and therapies. How do
Uh-huh.
you integrate that into, potentially adding homeopathy?
Yeah. So I am not a purist because I'm a realist and I need to meet people where they're at. And the reality is sometimes you need to use medications, supplements, whatever it happens to be, to just get through your day. Because homeopathy, as I've said, is not a magic cure overnight. It's a long haul. You have to see it through to the end, but you have to live your life in the meantime. So the approach that we take is we do need to be able to see what's doing what. And, at my practice, we're all naturopathic doctors. So we all have training in the broad range of the things that people are using between conventional medicine and natural therapies, functional approaches. So we have an understanding of what those things are likely to be doing in the body, and the primary action of the medications, the supplements, et cetera, and also what we expect from the homeopathic remedies. And so the one thing we do, the way that we sort of walk that line is that we make sure that we're making one change at a time. So if they're working with a functional medicine practitioner, and they're making changes, we say, okay, we need to see what the baseline is with these, and then we see what we need to do with the remedy. So we know what's happening from which thing, but we don't have to like completely like stop everything else. And in fact, that just doesn't work very well because what happens if you ask people to stop everything else, then you put them into crisis,
Right.
for these things that are like keeping them to the whatever point of stability they've reached. And so you're not actually dealing with the condition itself, you're dealing with the withdrawal symptoms of the things that they've been using and the condition. And it's just very, very confusing. And what we see for people who do try to do this is that sometimes you're going downhill with your symptoms, but the reality is you're not going downhill as fast as you would or as much as you would if it weren't for the homeopathy. But we can only like say, well, from our experience, we know that people who aren't using homeopathy generally have this happen, and you're not, 10 feet down, you're only 5 feet down. So you're probably responding to the remedy, but you still feel worse than you did before you started it. So it
Right.
just gets really complicated and confusing. And so we say one change at a time. Our goal with homeopathy is to help people heal and to not need us, right? And like, most people go into healthcare because they want to help people heal, not because they want to just have patients for life, right? And so most people come to homeopathy hoping they can stop taking medications and supplements beyond like basics to just support their functional needs, right? Um, and so we also ask them to gradually and slowly make changes so that the body can adapt and we can see how the body needs support with homeopathy based off of how they're responding to make those reductions and make those adaptations to their routine.
Great. Well, like I said, I love homeopathy. Again, it's been an integral part of my practice. I actually studied with a Dutch homeopath in Belgium for a decade. It was, again, classical Hahnemannian trained homeopath, and learned a ton from her. I know for parents, who are having children dealing with PANS, it's such a difficult struggle, and I know they're
Mhm.
always looking for good ways to help address these issues. And again, homeopathy is a very safe, inexpensive, generally speaking, way to help address a lot of this. So, for people who might want to work with you, do you just work with people locally? Do you work with people around the country?
We are a virtual practice, so we don't see anybody locally. We've
Okay.
got providers. There's 15 of us that work together, and we consult and collaborate together. So we always tell people that like even the toughest cases, we've got worst case scenario. You got 15 docs giving their opinions and giving their thoughts on your case. So yeah, we work virtually, and so we consult with people actually all over the world. And so we only do homeopathic consultation. And so we require that people have a local provider because we, as naturopathic doctors who
Yeah.
are, specialists and experts in homeopathy, we still understand the importance of medical intervention when needed. And so we love when we have people who have functional medicine providers that we can also collaborate with, to help make sure that we're doing the best that we can on both ends to support somebody and It works really well.
Great. So where can people find you, Jenn?
So you can find us on our website, resiliencenaturopathic.com. We've got a Facebook group where we actually interact and answer questions and teach people even more about homeopathy so that you have every tool that you need to possibly be successful in the process to get you to full recovery. And that's Homeopathy for Pans and Pandas in Facebook. And then you can find us on social. Our social's not great on for Instagram or TikTok, but we're working on it. But they're all at Resilience Naturopathic, where you can find us there as well.
Okay, well, we'll definitely post a link to your website in the show notes. So for people who might be interested in working with you, we'll make sure that they have that information available. And again, I've worked with the patients over the years that have worked with you and other doctors in your practice and have had really great results. So I would highly recommend if this is something that's of interest, to definitely reach out to you and explore it.
Well, thank you so much for having me. I always love getting this opportunity to talk to
Great.
you.
All right. Thanks so much, Jenn.